Good day, wherever you may be. Um, my name is Michael. I'm hosting this webinar, soon to be joined by Allison Still, our LIS system expert at Legal Lab. Thank you for taking the time out of a busy December. I'm sure we were just discussing this, making some small talk before we started the webinar recording. Where is this month of December going? I'm sure everybody's got plenty of things to do, plenty of things on their mind, but hopefully one of them is how they might be able to improve their work environment within a laboratory. So that is the topic we are going to discuss today. Streamline, scale, and succeed, modern automation strategies for AP and clinical labs. Again, my name is Michael. I'm on the communications and PR side of things for Legal Lab, and we are happy to be joined by Allison Still. Allison, as we kick things off, just give us a little brief background of yourself and your role within the company.
Hi, I'm Allison Still. Let's see, I come from a laboratory background. I worked in a laboratory for about 5 years before I moved to IT, and I've been working with the Legal Lab application now for just 10 years this year. Um, at Lego Lab, I am the LIS product manager, so I vet new development items that come from internal stakeholders and our clients to determine what we should work on next.
Very good. We are always very happy to hear from you, and especially on the development front, which we might be able to talk a little bit about here as we go. I do see we already have somebody that has entered a question. That's a good reminder that we plan on doing a Q&A, an interactive Q&A at the end of the presentation. I'm going to do a quick little intro, and then we're going to turn it over to Allison, and she's going to actually take us within the LIS system and the software itself, and give us an idea of how you can automate what are, in a lot of cases, manual steps to really help out your lab's efficiency and ultimately your productivity and profitability too. So my intro starts with this. Hopefully this is not a familiar situation for you, but maybe it is. The monster within the lab. And on the screen, you can see all these very key elements that the laboratory needs to be able to handle on a daily basis. And in a lot of cases, it is multiple laboratory software systems that are being utilized to get the job done. We believe at Legal Lab that there is a better way to do it, an all-in-one informatics platform. We're talking about an LIS module and an RCM lab billing module, fully integrated within the software. And then, of course, support for other key elements such as digital pathology, artificial intelligence, both real big topics during the course of 2025 and certainly will be in 2026 as well. Distribution engine, automation engine, direct-to-consumer lab testing. All of these elements we believe should be part of one comprehensive platform. And that's been our goal from the start of Legal Lab, to get this to you, the laboratorians out there, to help you do your job a little smarter, a little faster, and a little better. And here is a brief look at the platform that I've been discussing. As you can see, it's all comprehensive, intuitive, flexible, all tied together. Anatomic pathology, clinical laboratory, supporting engines, interface engine is a big one, rule and automation. That'll be the primary topic today, as Allison shows us how rule-based automation can really make a difference within your laboratory environment. Of course, it might seem to kind of click and make a lot of sense once you hear this, but why would you have separate workflows for technical and then financial workflows within your laboratory? We believe that tying them together and having end-to-end data integrity is a key to success within your laboratory. And our hope, and some of the folks that are attending this webinar, I know are actually current users of the platform. So thank you, and we appreciate your your partnership. And then those that might not be with us, but are, considering maybe an LIS software update or a change, uh, we like to think these are some of the elements that we can help you with to transform your laboratory. Again, automation is going to be the primary topic today, but it all kind of ties together. Another key, I think, is reducing complexity by standardizing workflows. In a lot of cases, a lot of solutions become very, very complex. We believe that that's not the route to take. We believe that by standardization, you can actually remove a lot of complexity and actually really improve your work environment. So let's get to the meat and the potatoes of today's webinar with Allison. We are going to show you real world examples of lab automation. We're basically going to take you from start to finish within the laboratory, starting with accessioning, making our way through the pathologist resulting and coding processes, all the way to dashboards and analytics and key data, allowing you to make smarter decisions within your laboratory and ultimately perform better for your customers out there. So Allison, unless you have a question, I will turn it on over to you and you can start sharing the legal lab environment.
Great. Thanks, Michael. All right. So today we're going to start with ordering, and we're going to start with a remote order. Now, this is an electronic order that was sent to the laboratory from a client's EHR. Here I am in the remote orders queue, and I'm going to just double click to open this order. All the information sent from our client's EMR is filled here in the demographics section, the client information section, and we'll see also in the order data tab. One thing I'd like to point out are these tags that appeared here in the bottom left-hand corner. These are an example of what we call special instructions tags. So these tags actually belong to the client so that every order for this client as a succession, here we'll have some instructions for the order entry personnel to remind them, in this case, that the patient ID is required, as well as a referring physician. We can add in a referring physician by searching like their first or last name. And now let's go to the order data tab. We see our incoming ICD and that this order has both a PAP and a surgical biopsy on it. And let's say that this was an ECC biopsy. We see some other information like the source, clinical history. These all came in from the external order. Now, if you are a laboratory with clients that want a lot of standing orders, we use our rules engine for that. And the Legal Labs application is going to handle all of that behind the scenes, though you can get a glimpse of them here if you would like by clicking on the rules bar, and any standing order rules attached to the provider will be seen here. So we can see the provider on this case has a rule to reflex HPV on the AGUS diagnosis, as well as to reflex chlamydia and gonorrhea if the patient is between 21 and 29. And one note, we did receive this order with a PAP and a surgical. I know in some other systems, these type of mixed testing have to be accessioned separately, but the Legal Lab LAS is designed so that all testing from the same data service can be entered on the same order from pathology, gynecology, clinical, microbiology, etc. And we'll just double check that the specimens information down here reflects what we received. Let's say it does. Here I have it just automatically ordering one cassette and one H&E for the specimen type. There is a lot of flexibility for what can be automatically brought in here, but this is appropriate for this specimen type. So then we can just go ahead and save the order. Any order validation rules that you might want to configure might come up when the save button is checked. to make sure some of those required elements are filled in or anything else that might be needed. But if the save is successful, like it was, then the first window you'll get after you save is the label print window. Um, Notice we're getting extra labels in here besides, just our order only came with a thin prep and um, surgical bottle, but the system specializes in knowing when to make specific derivative specimens based on what you received. So it knows because a PAPA's test was ordered that we're going to make a guide slide from our thin prep. And then the system's also configured to make like an Aptima transfer tube off of this thin prep, but we can see those specimens aren't printing up front. We can have a dedicated downstream workflow to print those for extra tracking. And of course, you can print them up front if you wish. It's all under your control. And the same with our slide label, right? Even though that was ordered up front, we want to print that later in the lab. So we do see it here, but it's not default checked. So we could print those labels, and then we have the opportunity to scan in the paperwork for our case. Let's see. Normally you would use like a benchtop scanner, but I'll just go ahead and select a requisition I have saved on my computer as an example. And then we can continue with laboratory processing. I'm just going to quickly look up the identifier for our case so I can continue on the next steps. All right, so the first place after accessioning in the laboratory that the specimen will go to is grossing. I'm going to use my home screen card to navigate to the grossing touchscreen, where we can scan our surgical bottle, and the case will populate into the window where we directed to the test info tab where we see the ECC specimen description typed at order entry. And here we're going to select the more specific site, area, and operation from the pre-configured options which fit or match this specimen description. So these pre-configured options will be tied to downstream automation, such as the application of CPTs and ICDs. So here I selected the ECC one, and also happen to have a default gross description template for this ECC. And here we are just going to fill in the measurements for our pieces with the on-screen keyboard that appeared. Like so. We can see a little note down here about the CPT code that was applied. Some pips on these tabs let us know that there's other things to see in these tabs if we're interested. Patient history, we can see the other tests that were ordered on this patient. And if there were previous cases, their data would appear here as well. Order data panel, so we can see any of the ask at order entry question information and specimens, so the grosser can review the specimens that were ordered. Let's say after examining the specimen, I want to order an IHC. I'll just click on the stain table, and when I find the one I want, we can double click to add on the first cassette. Now, let's say that we encounter a discrepancy when we are working on this case. We're going to use our tags and workflow action functionality to track this issue. So I'm going to click on the price tag icon down here, and we see some workflow actions that I've configured, such as discrepant patient name, discrepant specimen source, or empty container. Let's say there's a discrepant patient name. So that this is a way we can track this issue within the application, so we don't have to track it in some kind of separate application like Excel or what have you. And it'll all be within the application, and it can also have additional behaviors such as holding the report until this issue is resolved. I can enter a comment associated with this. Let's say maybe file or Action's name is Sarah Rex. Cheryl, something like that. And then this will go to a queue with all such issues where someone can handle all of the issues at the same time. Um, and the grocer and the rest of the lab work can continue. When we're done grossing, we will save and print our cassettes if we would like. So let me take a second to show an example for the statistics report. Looks like corresponding to that like workflow action issue that we put in. I'm going to go to slide stats and I have this template configured for slide through it. And we can see all the different types of workflow actions that we have configured and the corresponding, in this case, pathologist for the case. We could also do it by at a facility, histotech, let's do assigned histotech, any of the other summary by options that you see there, right? So here you can get an idea of how many issues that you've had over time. You can also summarize them by client. You could see if, you know, certain clients are sending you specific issues. And after that, we can move on to block and slide processing.
And I'll just step in as you move there. Reminder that we are going to have a Q&A session following this presentation from Allison. So if you have a question that pops in your head as she goes through the processes, please just enter it. We'll make sure that we see it and bring it up at the appropriate time.
Great. So after grossing is complete, we can move on to block processing. This is a queue from which we can track processing all of our blocks as well as embedding. If we want to track processing, then we'll start by clicking this Begin Process button at the bottom and scan the blocks that we are loading into the processor. Here we'll see each block that is scanned added to the window. The system is going to track the user who is performing this action. We can click Begin, and it'll write the timestamp for when it was loaded into the processor. And when we're ready to take the blocks out of the processor, we can switch our status, and then we'll use the end process command. At this time, you might also want to use the checkboxes to bring the blocks into the window, just showing you can scan or select from the queue. And then finally, we will come back and do the same thing at embedding. So tracking the processing of the block in our system is definitely optional. You know, it's just extra step there to track if that is useful for your specific laboratory, but you can definitely skip those steps if you don't find it helpful. Let's edit this block here real quick. Just want to show you the specialized audit that will be generated related to processing and embedding if you do choose to perform these steps. And we do have like an out-of-box processing turnaround time report as an example. And not only is the user and time tracked for these actions, as well as the facility, right? All these actions have been logged into like our main laboratory the whole time, but maybe we have additional laboratories throughout our organization. So this way you'll have a nice chain of custody for where every step of the workflow happened. In fact, let's look for a second at one of our other locations within this laboratory. We have a rural location. And if we were to switch our location, I can see there's actually a completely different set of blocks pending at this facility. So the Legal Lab queues, in addition to being real time, are also facility gated in this way, right? Each queue only shows not only what is pending for that step, but also what's pending for the current facility. This is a feature we call site security. Again, you don't have to use it. You can also turn it off. But when this is turned on, if you do want to move any specimens between facilities, maybe some cases are accessioned at one facility, but then going to be processed at another one, then you can use our transfer workflow to move specimens between facilities. And then again, you'll have tracking of those actions. And then when the specimens are received at a facility, then they will become visible in the receiving facilities queue as well. And after block processing, we can go on to the same for slide processing. Let's make sure we're back at main laboratory. Great. So here we're going to, this is a real-time list of all of these slides that need to be cut. From here, we will click Assign, and we can scan our block, and then all the slides that need to be cut from the block will populate in the window, and their labels will print. So then we can assign, like, yes, I am cutting these, and then when they are done, we will come back and tell the system that those slides are complete. Like with the blocks, we could use the checkboxes instead if we wish. Okay, after a block and slide processing, then we can finally go on to the pathologist queue step. So the pathologist queue by default shows all of the cases that are ready for the pathologist. By default, we filter it so that cases that are still pending in histology don't show up here, so that the pathologist only sees what is ready for them to work on. However, again, you can use the filters, if they do want to see what's coming, or if you're not using certain processes like the block processing. So you want to see, where those blocks are at and things like that. You can use the various filters up here to locate additional cases. Additionally, even if the case doesn't show in the pathologist queue for whatever reason, they can still scan a slide from the case, and the corresponding case will open for them. So this is the main results screen. Um, Here we see some more special instructions tags, but these are, instead of for accessioning, they're for the pathologist, right? So they can make sure in this case to include margins in the diagnosis, and that this client also wants microphotographs. So to take an image, we can go to the devoted images tab, or we can actually add it straight from here. If the pathologist has a microscopic camera on their microscope, then we can click this button or use the corresponding keyboard shortcut to open that, take a picture like normal, and then it'll bring it into the LIS. Since I don't have a camera right now, yeah, I'll just add an image that I have saved locally on my computer to see what that looks like. We can see the CBT that was added at grossing here as well, but there's no ICD as we haven't entered our final diagnosis yet. So today, as part of entering the diagnosis, I'd like to showcase our new embedded speech to text feature. So you see these icons on the bottom right. The first one's a microphone, the second one's like an A with some lines. The first one is speech to text mode. So when I turn it on, it'll start translating everything that I say. And the A is command mode. Commands would be like moving between specific fields or tabs. And I can also use a command to release the report. So I'm going to turn on the mode to show a command of moving between tabs. And right now, go to billing. We can see it goes to the billing tab. Go to results. And we can see it moves back to the results tab. Now I'm going to also use it to enter my diagnosis macro, HDT. Perfect. So I had a final diagnosis macro with the abbreviation HDT. that was applied. And in the system, this macro also had a linked microscopic description as well as a comment. So those came in as well. And we can see our report preview updated to show all those new elements as well as our image. Um, Finally, I can use a command to release the report as well. I didn't have to pause between all of these actions, right? I could have performed them all together. I was just taking time to explain them. Also, the final diagnosis that I applied came with an ICD, so we can now see that on the sidebar as well. But now I use the command to release, and we can see the result was released and closed. So yeah, that's a new feature that we developed this year and will be enhancing with more commands over time.
So to be clear, this is all the same software. It's embedded within Legal Lab. There is no third party involved in this case.
Yeah, that's absolutely
Wow,
correct.
very nice. Latest version of the software? Or did you say it's still in development?
So it I mean, what I showed is done. Um, we will be improving it over time with more commands. For example, right now there are no like text processing commands like select all or delete last word, things like that, or not as many as there could be, right? So the basic like speech to text and commands like entering your macros or like commands that match keyboard shortcuts that we have configured for our own shortcuts, like moving between the fields and things like that. Those are in. So we'll be just like, adding more features over time.
So a nice preview and a present to look forward to in 2026.
Yeah. But yeah, I
Awesome.
mean, the functionality I showed today is ready. Um, yeah, now I mean, this is version 2025 1, and we actually closed out 2025 2 and are already starting 26 1.
All right, awesome. I didn't mean to put you on the spot, but you nailed it. That was really cool to see.
Okay, for our final section, I'd like to show some dashboards. Um, but I didn't have them loaded up, so I just need a second for them to refresh. I'm going to show a different environment for the dashboards. The environment I have been showing up until now is the demo environment, so it doesn't have the most realistic set of data to show for dashboards. Better to have real data to show. Um, Michael, are there any questions that I could answer while I'm waiting for this to load?
Yeah, I think so. One of the questions that came in early in the presentation, what are the biggest efficiency gains labs typically see after replacing mostly manual workflows with LIS automation?
Uh, I mean, that's a lot. It's hard to say what the biggest one. Um, I guess one that stands out for me is like elimination of things you might be tracking in Excel for QA issues, or like any kind of tracking logs, like slides or blocks received at a specific bench. All of those things can now be tracked within the LIS.
The other thing you mentioned briefly earlier during your presentation was tags and workflow actions. The
Yeah.
question is maybe you can provide a little bit more detail about what each is and how they work within the system.
Yeah, absolutely. So, yeah, tags and workflow actions are two different things. Sometimes I say it so fast, it sounds like it's one thing. Tags are the more simplistic one of the two, kind of just like a flag. Um, and it can be used to indicate something manually in a workflow. It could be added um, using automation. They're really there to support any auxiliary workflow that you might have. The tag is sometimes described as like a sticky note that you put on something, like this is high risk. This is a new client. This was sometimes like background actions, like this was sent across an interface, all sorts of things like that. And then a workflow action is similar, but more. It comes with a comment, like I showed, and then it also creates a queue of all the pending workflow actions. So it creates like a task list for someone who needs to perform them for like quality issues, or maybe calling the client for just like following up on critical results, things like that. So it has like a status, like it's like a task that needs to be performed. Um, both of them, can be added manually, can be added by the rules engine. They can show up here, like in the sidebar, in the queue to be attention grabbing, as well as like directly in the window, like the few that I showed earlier, like down here. And both of them are built into like our stats reports, so you can get stats on both the tags and workflow actions, how many you had over time, by client, by user, um, all sorts of stuff.
Yeah, I
All
think I
right.
can sneak one more in here. What challenges do labs face when scaling across multiple locations with legacy LAS systems? We haven't mentioned legacy LAS systems in comparison to a modern laboratory information system platform. So you have plans to scale across multiple facilities. What advantages or where are the roadblocks, first of all, with the legacy software? And how do you overcome that with a more modern informatics platform?
Yeah, common roadblocks I see is like different facilities using different instances of the LIS, or yeah, like their databases are separate, or sometimes even completely different LISs depending on the organization. So really having everything in the same system, especially between your facilities is really helpful for tracking and just reducing complexity. And then also the Legal Labs multi-facility support. So you can still have some segmentation of, what's at different facilities while keeping it all in the same database, and the ability to transfer things back and forth. You can have some users that only see what's at their facility. You can have users that see things at multiple facilities, like users who move around a lot, or pathologists who are signing out from different locations. And then also you can give your admins like global site access so that they always see everything.
All right. I think I now see we have some dashboards on the screen, so take it
Yeah.
away.
Yeah, so these are dashboards. These are real-time data displayed in the LIS. Here I have a couple different tabs of different ones. So here's like a time of day accession count. This can be really useful for knowing, like when you might need or want to staff your accessioning teams. Um, Here I could like filter it. To specific dates. I think this is actually like all time, but I could change it to like, I don't know, just through last week, for example, right? It's still pretty similar, but our counts are smaller. You can filter it by facility. Um, Here we have one for lab turnaround time. All these widgets are scripted in some combination of JavaScript and SQL. And most of them are coded by our engineers. But if laboratories are lucky enough to have someone who is skilled in these coding languages on site, they are also able to make their own. Um, this is a common format we have where like the lines are averages and the bars are like this week, right? So we can see this lab received, more blocks than average on Sunday, for example. Similar with like embedding and slides completed. And then we also have these pie charts. Yeah, those are the most useful widget types we have, I think. And yeah, these
I'm
all
looking,
represent.
I'm sorry to cut you off. I'm looking at that, and then you can just kind of put it into a real world example where if you're able to track this data in real time, you know that at a certain time of the day, you might need more medical laboratory technologists
Mhm. Exactly.
at a certain time, whereas maybe you're overstaffed and you don't know it because you haven't been tracking this kind of data.
Absolutely. And it's just really, really nice. Like this data is otherwise like really readily available in our stats reports, but sometimes it's just nice to get a visual, like quick at a glance. Um, and each user can have their own like unique display here, right? Like again, I'm logged in as admin here, but if someone else on the team logs in, they could have a totally different spread of dashboard widgets here that are more relevant to them.
So if you don't have the real-time opportunity that we're displaying here, kind of give us a picture of, and I'm sure people attending understand this fully, give us a picture of what it would take to track this manually. And yeah, I'm guessing obviously not real time, but maybe this is something you do once a month.
Yeah, yeah. I think a lot of these reports, labs would pull like monthly. Um, and like I said, you can extract the data, almost all of them from our stats reports. But if you want to get a visual, yeah, you would like have to export them to Excel or something similar. Some clients use Power BI. And then, yeah, it's not going to be as real time, and it will just take more time to process it outside of the application. Um, yeah.
All right, that is really really interesting to see. I guess we should have you continue to keep the platform open at the moment. We'll circulate the opportunity for a few more questions if we can sneak them in. And then we can let everybody be on their way and get back to their busy Tuesday. I guess maybe I'll put you on the spot one more time. This one, 2025 in some ways is kind of a blur, right? There's so many things that have happened and occurred since January 2025. From your point of view, either personally or, from a development point of view, what really stands out for 2025 for you, Allison?
Of the things that we've completed.
It can be that.
The
It can be something, I mean, you've visited lab partners, you've been involved with implementations. Again, I put you on the spot here. I'm sorry about that, but I'm just kind of interested, I'm kind of in that reflective mode, where where we've gone from January until now.
Yeah, it was a really busy year at Lego Lab. Yeah, lots of on-site visits to prospects and current customers. Like you mentioned, we went to some conferences. A lot of good features for the LIS completed this year, such as the speech to text, which I showed. Another feature I've been working on a lot is OCR for order entry. So where for clients who you might not be able to interface with and you get paper requisitions for, the ability to like just scan the document ahead of time, and the system will digitally read the document, including handwritten, and like translate it into the corresponding fields like client name, patient name, etc. We actually did recently finish another exciting feature that I call the scheduled stats reports. So any of your current users, we have many search and stats reports in our dynamic reports within the application, but we did finish a feature to have them like automatically exported, meaning mainly like emailed to you on a schedule, like you designate a report you want to get, at the end of every month, on the first day of the month, what have you. And yeah, it'll be emailed to you, or the other option is like you can have it saved or downloaded to a specific location on your computer or similar. So we've been working towards that feature for a long time. Um, we've been doing a lot of performance enhancements system wide, and some security enhancements. So yeah, busy year.
How about digital pathology specifically?
Oh
Uh,
yeah. Uh,
where have things gone over the course of the year on that front?
well, we now have a partnership with Path Presenter. So they're kind of like our digital pathology vendor of choice, though you're not locked into them. We still have clients that, use the whole gamut of the different providers. I actually have I didn't set it up. Never mind. I could have showed it. I'm sorry, I didn't prepare to show it on the demo today. But it basically is like a seamless integration. So when you open the case from the pathologist queue in Legal Lab, it also opens the corresponding case in the digital viewer in a separate window, ideally on your additional monitor. And it'll be contextual. So like when you open the next case, it'll in Lego, it'll open the next case in the viewer. And in the viewer, you can take advantage of all of the features they have in there and then bring any fields of view back into the LIS that you want to store there or have show up on the reports. So yeah, we're integrating with a lot of different digital providers on the market. And yeah,
All right, another good one here. Question that just came in. How difficult is it to configure the rules within this LIS system? More or less, the question is, do you need an IT background to do this or not?
I mean, it does take, some time to get familiar with it, but I mean, I didn't have any IT background before I started working, with the application. That was like how I moved into IT was just like becoming a super user of the application at the laboratory where we worked. So yeah, I think it's pretty intuitive. Um, yeah, I don't have any IT background, so I'm completely self-taught, and you can be too.
All right, that is great. I think we can roll from here. If there are any last second questions, I'm going to try to put my screen up now. Um, we can take them now, or you also can reach out. I think it's at the bottom here. Hopefully you can see it. I included Allison's email address to reach her directly if you are a little shy. We do have a couple of questions that did come in late here. Oh, it looks like you addressed it already, so perfect. Um, with that, I think we can wrap up. Um, Allison, a nice journey through the software once again. We actually, from a 2025 point of view, I must say that we started doing these webinars with Allison, our LIS expert, probably right around January or February. And they continue to be very popular. We continue to get good response and a good amount of attendees. Um, wanting to learn more about the software, whether they are new customers or they are interested in learning more about Legal Lab. So we welcome that. I have a feeling we're going to do many more of these in 2026 as well. So hopefully you're ready, everybody out there, along with Allison. Allison, you ready?
Yeah, we're ready.
All right. So happy holidays to everybody. Thanks for attending. I will send a recording of this presentation to everybody that registered beforehand. So something to look forward to in your email in the near future. For Allison, my name is Michael. Thanks for joining us and have a wonderful day.
Thanks, everyone.